Hi, I'm Dr. Caldas, this is Dr. Day, and we are faculty at the VCU School of Pharmacy, and we are VRX. So today we're going to be doing a video about blood pressure assessment, and Dr. Day has been a wonderful volunteer to let us go ahead and use him today for this assessment. So the first thing when you're going to take someone's blood pressure that you want to do is have them nicely positioned. And then, so you can see Dr. Day's feet are nice and flat on the ground. His back is supported against the chair, and his arm is flat at about heart level on the table. If you position someone where their back isn't supported, their legs are crossed, or their heart maybe if you're on like an examining table and their arms down to the side, that will fluctuate the blood pressure between 2 and 10 millimeters of mercury, which can be the difference between medication therapy or not. So what we're going to be listening for today, once we get him all set up, are for blood pressure. The top number that you usually hear, so say 120/80, is our systolic blood pressure. That is going to be the first noise, cough noise that we hear when we're listening to the blood pressure. That is when the heart is in full contraction, so it's kind of its most stressed. And then when we listen to the video, we'll hear his heart or hear his cough noises. The very last one is going to be his diastolic, or when his heart is most relaxed. So we've got a couple questions for him now that he's positioned well. When we have someone for blood pressure, we have a couple questions we need to ask them. The first one is going to be making sure that he's been seated for about 5 minutes, which we're going to go ahead and say yes.
Yeah.
The next is to see if he's had caffeine or nicotine within the last 30 minutes. And so we know that both of those things can raise someone's blood pressure. So have you had any caffeine in the last 30 minutes?
Yes, I have.
Yeah. Have you had any nicotine?
No nicotine.
So we've got caffeine on board. That lets us know that his blood pressure is going to be a little elevated. Really, it's for that first 30 minutes. So that just helps us when we're making clinical rationale. So we'll go ahead, and the next question we need to ask him is, what has his blood pressure typically run? And that lets us know how much we're going to pump up the blood pressure cuff.
Yeah, it's typically 130/80.
All right, so 130/80. So that helps me know that I'm going to go to at least 150 when I'm pumping up my cuff on my dial here, so that I make sure I hear that first noise and I don't come in the middle of his beats. So we'll go ahead and start for that. When you're putting a cuff on someone, there's a lot of measurements that you can do for the circumference of the arm and the distance between the antecubital space. But for us, we're going to have a handy cuff today that actually has it telling us on the side if it's an appropriate size or not. All right, so we'll wrap this right around. The nice thing about this cuff, it even has a artery line up, so it lets me know where to line up with the brachial artery. If you do not have that indicator on the cuff, then you can use the tubing, but since it's here, I know exactly where to put it. You can kind of see right here as we wrap around that Dr. Day is right within the normal range for this cuff, so it's an appropriate size for him. Having the wrong size cuff can falsely elevate or falsely lower, depending if you have gone too small or too big, respectively. All right. As we're looking at our stethoscopes, so for your stethoscopes, when you've never used one before, it can be a little daunting of how do you put them in. If your stethoscope has it where the earpieces point to a certain direction, you're making it look like a nose, and then you're putting it in ears that way. That's the most comfortable, and to create a seal so you can hear the sound pretty well. All right. If you didn't know where Dr. Day's blood pressure usually runs, or another group will say to go ahead and get the brachial, to be able to find the brachial artery, you can kind of put your fingers here, and you'll see some individuals pumping up to about 20 or 30 millimeters of mercury to palpate for the brachial artery. I will tell you that if you've done this enough, you get used to the anatomy of individuals' arms. So in practice, most of the time you won't do this first pump up. You will just be able to put it in the place where it anatomically makes sense to put where the brachial artery should be. So I'm not going to do that part, but you can see you put them right here, and you can pump up to about 20 or 30 millimeters of mercury. So for me, since I've done this a couple times, I will go ahead, and I know where to put my stethoscope is going to be right here, but I want to show you on the stethoscope, there is the bell, and there's also the diaphragm for the stethoscope. For the bell, you'll see this used in pediatrics a lot. It actually has an argument that is better for picking up blood pressure sounds, but since you have to be more used to it, and it takes a lot of precision for the bell, most people in practice use the diaphragm. It's also easier when you're working with a blood pressure cuff because it's flatter. Also, you'll notice if you put your thumb right on the middle of where any of the metal is, or even on the sides here, you'll start picking up your own pulse, and that can be very daunting and confusing for what you're trying to hear someone's blood pressure. So most of them come with some sort of rubbering where you can put your 2 fingers, and then I'm going to wrap my thumb behind his arm to be able to make a pressure and have a nice seal. So I'll put this in here. Thank you, Dr. Day. And then you can just relax your arm for me. And then I'm going to put my thumb to the back, and then I've got all these nice cords. But of course, don't forget to put your stethoscope in your ears. Okay, here we go. Now, you'll see you've got a lot of things to hold on to here. So luckily, my meter here will actually hook onto my cuff. If it didn't, I'd have to put it in a spot where I could read that and hold onto this and go ahead and use my dial at the same time. But luckily, mine hooks on. Another key part is that this, depending on your meter here, you can actually see that this one can only give even numbers. So some cuffs may have the 5s marked by 5s as well, but for mine, I can only do it in evens. I've marked it every 10. So this is a good thing to know. That's one way when my students report an odd number, it doesn't work. Okay, so we're going to nice here. You'll also see I immediately locked with my forefinger and my thumb. If you try to do 2 hands to lock your dial here, what could happen is once you pump the cuff all the way up, you're not going to be able to release it because you made it too tight to be able to release with 1 hand. So I did 1 hand here, and I'm going to pump up. Again, Dr. Day says his systolic is around 130, so I'm going to take it to at least 150 so I hear enough. And then I'm going to listen for the sounds decreasing at 2 millimeters of mercury at a time. Sometimes you'll hear it, you will see the dial move before you actually hear the sounds. So you have to make sure you're actually hearing the sounds. And so I heard him at 128 over 88. Good job today. And you can see I went ahead and I listened a little bit longer than what I thought I actually needed to make sure there wasn't an actual gap between the blood pressures. So when I heard it, I pumped to 150, released it to that 120, and heard it at 128. And then I kept listening to the noise until I got to 88, and it went away. But I let the cuff go all the way down to about, at least to 78, but I let it go to 66 before I confirmed that that was the rest of the blood pressure. And then I instinctively released the valve because a lot of students, they get so excited, they go, oh, those are numbers. They start writing it down, but your cuff is still inflated and applying pressure. So make sure you release it at the end. And then you notify your patient. You say, all right, Dr. Day, today your blood pressure was 128 over 88.
Thank you, Dr. Caldas.
Thanks so much for watching our video.